Hi, this is Scott Cartwright,
And this is Dr. Rudy Cartwright, the MS Health Coach.
and we want to thank you for checking out our video. You know, we get a lot of questions regarding what are the latest and greatest multiple sclerosis treatments out there. And our approach is a little bit different than most in that we try to do things and tell you all the things that you need to know in order to strengthen the health side of your body. And we also like to bring to you information that nobody else out there is talking about. And hopefully, we think that you'll find this video will be no different. We're going to be talking about what you need to do to get rid of your MS pain in this video. We're going to tell you where some of your pain is coming from and some things that you can do to get rid of that pain. Before we do that, just a little bit of background about us. My name is Scott Cartwright. I have a master's degree in public health and I work with people and their diseases all day on a daily basis. And I'm also the founder and creator of MS Health University, and I put that site together because MS affects me personally. My wife has MS, and when we were looking around for information, we couldn't find a lot of good information out there, and I thought it was something good to do to put together a place where we could share all of the great information that we come across and found and put it in an easily consumable version for you.
Dr. Cartwright again. I'm a brain surgeon and an expert in multiple sclerosis. And if you're wondering how a brain surgeon becomes an expert in multiple sclerosis, let me just tell you, I have over 35 years of training and experience. And during that period of time, I've seen my share of brain injuries and spinal cord injuries because of motorcycle accidents and truck accidents and car accidents and you name it. And what occurs to the spinal cord and brain over a short period of time because of those injuries occurs in multiple sclerosis over an extended period of time. Now, why am I so passionate about multiple sclerosis and helping those who are recovering? Well, several years back, my lovely daughter-in-law was diagnosed with multiple sclerosis right in the middle of her medical school training. And my son got on the phone and called me and let me know about it, and I said, don't worry, I know what to do about that. And that sent me back to the library doing a great deal of research which I was accustomed to doing. And over a period of time, I put together a program for her that she followed, and I'm happy to say that she finished her medical school training, and now she is doing quite well right in the middle of her residency training. And that's where I was willing to leave it. And one day, my son walked in and said, Dad, you got to share your information with other MS recoverers. And I said, no way, Jose, I am not interested in the limelight. But he kept hammering on me and hammering on me and hammering on me, and I gave in. And I started to share this information with others. And I want to share some of that same information with you. And here's a slide on my neurosurgery degree at Baylor College of Medicine, all of 5 years.
All right, great. So before we jump in and figure out what you need to do to get rid of your MS pain, I need to let you know that Dr. Cartwright is a medical doctor with over 35 years of training and experience, but the information we're sharing with you today is for informational purposes only and should not be considered as medical advice. Dr. Cartwright has not seen you as a patient and cannot give you medical advice, so whatever you do, please be sure to consult your doctor before you make any changes to your medical routine. And with that, we'll let Dr. Cartwright explain what you need to do to get rid of your MS pain, and we don't want you to look at this as a multiple sclerosis treatment, but rather all the things or some of the things that you need to do in order to strengthen the health side of your body so that it can be as strong as it can be in order to defeat the disease side or the multiple sclerosis side.
Now let's face it, the multiple sclerosis treatment as far as pain is concerned is the same treatment that they use for other problems in medicine. But what we want to bring to you is the concept and the published information that says that you can strengthen the health side of you so that you will have less pain when it comes to multiple sclerosis. And again, I present journal articles. In this slide here, there are 2 journal articles. The one at the top gives you what the journal is, what the title of that article, and then it gives the authors. But the important thing is the main point of the article, and that is St. John's wort has a good effect in terms of pain. I know everybody thinks of St. John's wort as treating changes for your mood, but St. John's wort is very effective when it comes to reducing the amount of pain that you may have. In the second article, again, zinc is very effective in reducing the amount of pain that you may be experiencing. And St. John's wort and zinc, they are not drugs. They are not drugs. But they do strengthen the health side of you so that you can do what? Get rid of or reduce the amount of pain that you're having. Okay, let's go to the next slide. What about magnesium? Again, it's known to reduce the frequency of the pain that you may be experiencing. So now it doesn't get any better. Look at this. Here you have something that reduces the frequency of your pain, and then you have the zinc and the St. John's wort that's reducing the overall pain that you're experiencing. It doesn't get any better. And of course, here we are talking about ginger. Ginger is very important when it comes to pain that you might have in your joints or your knee. Or your knees rather. So the important thing is these are normal things that you can use to do what? Help relieve the pain that you are experiencing in terms of your multiple sclerosis.
And can you talk a little bit about what does the magnesium do, for example?
Well, what the magnesium does is that it balances out the calcium that's going on throughout the body. I've given talks about that bad actor calcium. Well, you got to have something in when calcium is doing its job too well. You can experience a significant number of abnormalities. Magnesium will balance that out. Okay? That's what magnesium does. It balances that out. It puts a cap on what the calcium is trying to do.
All right, great. And before you go on to your action steps, because I know you have some action steps on what you need to do to get rid of your pain, I think it's important to point out that the point of these articles and sharing this with you is so that if you wanted to read up on these different things for yourself, you can look in the journal article, you can look at for the date and the pages and the title, and you can read up on more information on it for yourself. And you can also find these things online and take them to your doctor. If your doctor asks you, why do you want to start taking magnesium or why do you want to start taking zinc, you can have the evidence to show them why you want to do these things, because your doctor probably doesn't even know. It's no slam against your doctor or anything. They just usually don't have the kind of time that you need to have in order to go through these things, and we do take that time to go through all these things for you. So you can either A, read up on it for yourself, B, take it to your doctor so your doctor can learn more about it, or C, both, all of the above.
Those are good points. Actually, they're great points. So let's look at the action steps. We want you to start taking magnesium, 400 milligrams, twice daily. Start taking zinc, 25 milligrams a day. St. John's wort, and when you buy it from one of your stores or wherever you shop, take it as indicated on the bottle. And learn to cook with ginger. It's a good edible plant that will help get rid of your MS pain.
All right, great. So we hope you got a lot of great information from this video. As I mentioned, if you need to, you can research some more on those articles yourself and find out more, and or take that information to your doctor. If you like information like this, we'd invite you to visit us at our website, www.mshealthuniversity.com. There you'll find more training videos that go into greater depth than what we're able to go to here. And it's all free training classes for you there if you just go to www.mshealthuniversity.com or click on the link in the description section. It will take you there as well. So until next time, we look forward to presenting some more videos for you, and here's to your health.